Lesson 9H, Female Hormones. In our previous lesson, we looked at how the ovarian and uterine cycles were affected by a woman's fluctuating hormone levels during the 28-day menstrual cycle. In this lesson, we will look at these hormones and their effect on the ovaries and the uterus. The hypothalamus, the anterior pituitary gland, and the ovaries all function to control a woman's hormone levels. The four hormones we will focus our attention on are estrogen, progesterone, luteinizing hormone, LH, and follicle-stimulating hormone, FSH. Estrogen and progesterone primarily act on the uterus, while LH and FSH primarily act on the ovaries. During the 28-day menstrual cycle, we will see examples of both negative and positive feedback. Day 1 of the menstrual cycle is indicated by the appearance of a woman's menstrual period, which is initiated by low estrogen and low progesterone levels. Follicle-stimulating hormone, which is released from the anterior pituitary gland, is found in higher than normal concentrations early in the cycle. This triggers many primary follicles in the ovaries to begin the maturation process. In contrast, luteinizing hormone, also from the anterior pituitary gland, is in relatively low concentrations early in the follicular phase. As the follicles develop, they begin to secrete estrogen, which has a negative feedback effect on FSH. As FSH decreases, only the dominant follicle continues to mature. We call this the Graafian follicle. The estrogen produced by the Graafian follicle eventually has a positive feedback effect on FSH, LH, and estrogen, increasing their production late in the follicular phase. The increased FSH has a further positive feedback effect on estrogen, which continues to thicken the endometrium of the uterus more. The spike in LH due to positive feedback causes the ovary to swell and rupture, releasing the secondary oocyte into the fallopian tube on day 14. We call this step ovulation. After ovulation, negative feedback brings LH, FSH, and estrogen concentrations back down to normal levels. The Graafian follicle, which ruptured to release the egg, is now called the corpus luteum. From day 15 to day 28, the corpus luteum in the ovary begins to secrete high levels of progesterone, which is now the primary hormone after ovulation. It also produces some estrogen. The estrogen and progesterone further thickens the endometrium of the uterus and has a negative feedback effect on LH, which inhibits further ovulation and uterine contractions. The uterus will now begin to secrete chemicals such as glycogen, proteins, and lipids to nourish the implanted egg. Mucus secretions will also begin to protect the uterus from infections. We call this phase the secretory phase of the uterus for this reason. If a fertilized egg implants, the developing embryo will secrete a hormone called human chorionic gonadotropin, HCG, which will maintain the corpus luteum for another 3 months, until the growing fetus can produce its own progesterone and estrogen via the placenta. The elevated estrogen and progesterone levels prevent ovulation while pregnant and helps to maintain a healthy endometrial lining during pregnancy. However, if conception does not occur, the corpus luteum in the ovary degenerates, and estrogen and progesterone levels drop, initiating menstruation. This is recognized as day 1 of the menstrual period, and the 28-day cycle repeats again.